Hello everyone, today we are going to cover our next chapter in our medical terminology textbook, Organization of the Body. And this is going to be a very important chapter for us as radiographers since we use the various planes in positioning. We use the terminology when we're going to be writing on requisitions as to locations of pain and things of that sort. So let's go ahead and let's begin. Our learning objectives for this chapter are going to be to name the body systems and their functions. We're going to identify body cavities and specific organs within them. We're going to list the divisions of the back. We're going to identify 3 planes of the body. And we're going to analyze, pronounce, and spell new terms related to organs and tissues in the body. So when we look at the body as a whole, we can take the body and we can keep breaking it down. At the very simplest level, we've got cells, and cells are individual units that are found in all parts of the human body. You've got brain cells, liver cells, skin cells. Tissues are similar cells that are grouped together to do a specific job, like your liver cells are going to be grouped together and form liver tissue, which is going to then form what is our next term, the organ itself. And the organs are structures composed of several different kinds of tissue. So within an organ, you may find different types of tissue. And then we've got groups of organs that work together to perform complex functions, like we've got the respiratory system, we've got the digestive system, and so forth. So cells to tissues to organs to organ systems. Our first body system is the circulatory system. And the circulatory system, that's going to include our heart, blood vessels, and the blood itself. The digestive system is going to bring food into the body and break it down so that it can enter the bloodstream. There's many different parts to the digestive system, all of which we're going to be covering in this curriculum. So you've got things that would be like the different organs, the stomach, for example, the colon. Then we've got accessory digestive systems as well, like our biliary system. The endocrine system. The endocrine system is composed of glands, and these send chemical messengers, which are called hormones, into the blood. So an organ will create a hormone. This hormone will travel to the or through the blood to a specific organ or location in the body to tell that organ to do its job. Of course, we've got the male and the female reproductive systems. Of course, the joining of the sperm to the egg to form then eventually an embryo. Our musculoskeletal system includes muscles, bones, joints, and connective tissues, and it supports the body and allows us to move. Our nervous system carries electrical signals to and from the brain and our spinal cord. Our respiratory system controls breathing, a process in which air enters and leaves our body. Skin and sense organ system. Sometimes you see the skin as referred to as the integumentary system. This book kind of combines them as one skin and sense organ. Includes the skin, eyes, ears, receives messages from the environment and sends them to the brain. Our urinary system produces urine and sends it out of the body through the kidneys, and then you have tubes from the kidneys to the bladder called your ureters, and then from the bladder to the exterior, which is termed the urethra. Body cavities and organs. So if you refer to your text on page 50, you can see that these are the various cavities within the body. You've got the cranial cavity, which is an organ that includes the brain. We've got the thoracic cavity, and the thoracic cavity is going to contain your lungs and your heart. And then we have our abdominal cavity, which includes a lot of different things: the stomach, the small and the large intestines, the spleen, the pancreas. And separating the thoracic from the abdominal cavity is a muscular partition, which is called the diaphragm. We also have our pelvic cavity. Now, some authors combine the two and they refer to this as the abdominopelvic cavity. Other authors will separate the two, abdominal and pelvic. So if we talk specifically about the pelvic cavity is what's going to include the urinary bladder, the ureters, the urethra, the rectum and the anus, and the uterus. The spinal cavity is going to contain the spinal column and all of the nerves of the spinal cord. For divisions of the spinal column, we've got the cervical region, and this would be helpful to look at page 55 in your text. We've got the cervical or the neck region. Then we've got the thoracic or chest region. We've got the lumbar, which is the loin or waist region. We've got the sacral region, which is your sacrum, lower back area. And then we've got the coccygeal region, which includes our coccyx or tailbone. So as far as numbering is concerned, we've got 7 cervical vertebrae, and this can be found on page 54 in your text. We've got 12 thoracic vertebrae, 5 lumbar vertebrae. We've got 1 sacrum, but the sacrum is made up of 5 small bones that have fused together. So we call these sacral segments. And then we've got the coccyx, which is 4 very, very tiny, 3 to 4 very, very tiny fused bones, which we call the coccyx. Frontal planes of the body. We've got various planes of the body. If you look to page 56, frontal planes, or a frontal plane is a vertical plane that divides the body or the body part, such as an organ, into front and back portions. So a coronal plane is going to allow the body to be split into anterior and posterior sections. Anterior can also be called ventral, and the posterior can also be referred to as dorsal. Sagittal planes. Another type of vertical plane that divides the body or the organ into right and left sides. The mid-sagittal plane, which is a very, very important plane that we use in radiography, the mid-sagittal plane, or MSP, divides the body vertically into right and left halves. So just like you can have an equal front and back, meaning anterior and posterior being cut through the body by a mid-coronal plane, you can have a mid-sagittal plane, which is going to cut the body then into equal right and left halves. But you can have a sagittal plane anywhere on the body, cutting the body into right and left sections. Transverse planes, also called horizontal or axial planes. It's a horizontal plane that divides the body or organ into upper and lower portions, as in a cross section. So once again, all of these planes are listed there for you on page 56. Make sure that you review then all of these planes, pages 56 and page 57, all very, very important planes for radiography. Let's move into some of the combining forms, okay, for these different parts of the body organization. We've got abdomino, which is the abdomen, antero, which means the front, broncho, our bronchial tubes. Our bronchial tubes are going to be our tubes that are going to come off of what's called the trachea, and it's going to allow then air to get into our lungs, our bronchial tubes. There's a picture of this on page 51 in your text, the thoracic cavity. So our trachea then is going to come down our midline. Then we've got two tubes coming off, which are called our bronchi. So broncho is the combining form for these tubes. Cervical means the neck of the body, or you also have the neck of the uterus, which is referred to as the cervix. So abdomino, antero, broncho, and cervical. Chondro. Chondro means cartilage. Coccygeal is coccyx or tailbone, as in coccygeal. Cranial is your skull. Epithelial is the skin or the surface tissue. And esophago is for your esophagus, that tube that's going to go from our mouth to our stomach. So chondro, coccygeal, cranial, epithelio, esophago. Hepato. Hepato means liver. Laparo means abdomen. Laryngo is larynx. Latero is side. And lumbo is loin or waist. Sorry about the dogs in the background. So hepato, laparo, laryngo, latero, and lumbo. Lympho. Lympho refers to lymph or clear fluid in the tissue spaces and the lymph vessels. Mediastinal refers to an area called the mediastinum. The mediastinum. If you take a look at page 57 in your textbook, the mediastinum is the area or the space between the lungs. If you look at page 57, there's a picture of a chest x-ray and an A, and you can see that you've got the lungs, which are the darker areas, and then you've got this white or clear area. The book is pointing to the heart area, but your mediastinum contains a lot of different structures, okay, but it's that space between the lungs, so mediastino. Pelvo is pelvis, which is the bones of the hip. Peritoneo. Peritoneo refers to the peritoneum, which is a membrane that surrounds the abdomen. If you refer to page 52, or I'm referring you to page 52 to look at, you can see that you've got a cross section through the body. They've drawn the diagram there for you. And you can see that you've got a covering to all of these different organs in the body. And this covering is going to allow our organs to basically stay in place. If you didn't have a peritoneal covering, things would just not be connected to anything. Everything would be falling into our pelvis. I've got some other functions of the peritoneum. Well, that's one of the main ones, though, that it's going to be there to act as a support. You've got structures that are actually behind the peritoneum as well. Those are called retroperitoneal. Retro meaning back or behind. And then we've got pharyngo, which is our pharynx. Our pharynx is our throat area. So, for example, you could say the pharyngeal tonsils. Okay, tonsils within the pharynx. So pelvo, peritoneo, and pharyngo. Pleuro. Pleuro means pleura. Pleura is a covering of your lungs. We're going to learn soon in procedures class when we talk about anatomy of the chest that the lungs have a parietal peritoneum, a parietal pleura, and a visceral pleura. Okay, so you've got a pleura that's right against the chest wall, the parietal pleura, and then you've got a pleura that's right on the lungs themselves, which is called the visceral pleura. But pleura is a covering of your lungs, so pleuro. Postero, back or behind. Sacro, the sacrum, 5 fused bones in the lower back. And then we've got spino, which is the spine or the backbone area. So pleuro, postero, sacro, and spino. Thoraco is chest area from thorax or the thoracic area. Tracheo is the trachea or the windpipe. It's going to be the tube that's going to allow air to enter into our lungs. And vertebro is vertebra or the backbone area. Let's look at some medical scramble terms and see if you're going to be able to identify what the word could be. A female endocrine gland. Now, remember, your endocrine glands are glands that give off what? They give off hormones. So the female endocrine organ would be the ovary. The second one, the space below the diaphragm. The space below the diaphragm. Remember, I told you the diaphragm separates the thoracic cavity and the answer is abdomen. Pertaining to the chest. Thoracic. Hip region. Hip region would be the pelvis. Throat. Throat would be pharynx. And your windpipe, layman's term for this structure, would be the trachea. A bonus term, procedure necessary for brain surgery. So think about what you've learned to incise into, and then for the skull area, term would be craniotomy. So before we close out this lecture, I'd just like to point out some things in the book. Let's look at page 48. On page 48 and 49, there are all of your body systems and some more detailed structures that are within each system. Body cavities are talked about on page 51 in the text. The number of vertebrae and the divisions of the back are talked about on page 54. I'd like you to look at figure 2.5, which is a drawing of the vertebrae, and then just to note, and we'll talk about this more later on, that between each of the vertebral bodies you've got discs. On page 56 and 57, there are the planes of your body. Make sure that you review the planes, the frontal, the sagittal, the transverse plane. On page 58, it gives you some MRI images with the anatomy being presented to you in different planes. Okay, for example, you've got A would be the coronal plane, and then you can also image in a transverse or axial plane or a sagittal plane. The combining forms then are listed for you on 59 all the way through to 64. Make sure that you do that work, completing those. Page 60 is very important. Table 2-1 gives you the terminology. And once again, these are some terms that we've just learned in our procedures course: anterior, posterior, inferior, superior, lateral, medial, distal, proximal, deep, superficial, supine, prone. So make sure that you read the description and the examples of all of those so that you are familiar with the different positions and the directions. Page 61 gives you some a cross-section through the female anatomy. Notice that most anterior then would be the cervix, and then going posterior, then we would have the uterus, and then we would have the rectum. Page 62 is important to look at. It talks about a lumbar puncture. And a lumbar puncture means that the needle is going to be put into the subarachnoid space and fluid is going to be drawn out, or medication is going to be instilled into this area. Page 63 at the top talks about ascites. Ascites is going to be easy to identify usually on a patient because of a very bloated abdomen. Ascites occurs when the abdomen starts to fill with a huge amount of fluid. Typical patients who might have this condition would be alcoholics, for example. At the bottom of 63, it talks about the pharynx again. Okay, you can see the drawing in cross-section there, the throat area. Page 64 at the bottom talks about a tracheotomy. Sometimes they have to incise into the trachea in order to put a tube for breathing. So a tracheotomy. Then you've got your exercises that follow that I'm going to have you do. And I'm going to quickly now go through the pronunciations so that you know the correct pronunciations for the terms. This is starting on page 73, and basically what I'm going to do now is just read through the terms so you have the correct pronunciation. So the first one is abdomen, abdominal cavity, anterior, bronchial tubes, bronchoscopy, cartilage, cervical, chondroma, chondrosarcoma, circulatory system, coccygeal, coccyx, cranial cavity, craniotomy, diaphragm, digestive system, disc, endocrine system, epithelial, esophageal, esophagus, female reproductive system, frontal plane, hepatitis, laparoscopy, laparotomy, laryngeal, laryngectomy, larynx, lateral, lumbar, lymphocyte, male reproductive system, mediastinal, mediastinum, musculoskeletal system, nervous system, ovary, pelvic cavity, pelvis, peritoneal, peritoneum, pharyngeal, pharynx, pituitary gland, pleura, pleuritis, posterior, radiology, respiratory system, sacral, sacrum, sagittal plane, spinal cavity, spinal column, spinal cord, thoracic cavity, thoracotomy, trachea, tracheotomy, transverse plane, ureter, urethra, urinary system, uterus, vertebra, vertebrae, vertebral, and that basically completes the list for the terms. I do want you to notice, and that to help you if you need extra help, when you look at these terms and they're given then the pronunciation, anything that's bolded, for example, would be the greater accent on that part of the word. For example, if you look at thoracotomy, it's thoracotomy. You can see that the cot then is bolded, and it is going to be that part of the word which is going to be more accented. So if you have any questions, of course, please contact me. Make sure that you follow the tasks and assignments that are going to be listed for this week for your assignments. But any questions, feel free to contact me.